Hello viewers, this is Dr. Isatu Kakay-Diallo coming to you today with a brand new topic, which is nothing else but COVID-19. COVID-19 booster dose or the third vaccine. Why we are giving it, why is it being given, and who are going to get it at this early stage of the vaccine process, meaning the ones that already completed, the first and second dose of either a Pfizer or Moderna. So before we get to that, I want to say hello viewers. This is now Dr. Isatu Kakay-Diallo. I come to you today with a new topic we get for deal with the COVID-19 vaccine booster dose or the third dose. Wait till make you need the third dose. So this one, a quick one, just want to go over the guidelines, the new guidelines we get for deal with the COVID-19 vaccine and why people them need the third dose. So why are people getting the third dose of COVID-19, vaccine? That's the first question we need to answer. And we already know what COVID-19 is doing to the world right now. And then it's a pandemic that we are dealing with since December 2019. With that, people getting this vaccine or the third dose, which is called the booster dose, it simply means to boost your immune system. And in that way, we can prevent possibly spreading the infection to other people or other individuals. And already we know the Delta variant of COVID-19 is very transmissible and rapidly, infecting individuals. With that, who are the people that should receive the COVID-19, booster dose at this time? So according to the CDC, they recommend that moderately to severely immunocompromised people should receive an additional dose. Who are these individuals? People who have been receiving active cancer treatment for tumors or cancers in the blood. Okay, those are people that are recommended to receive the third or booster dose. And then people who have had an organ transplant are individuals who should also receive, the third or booster dose, or they are taking medicines after the organ transplant to suppress their immune system. And that's why they are immunocompromised patients or individuals. And then if somebody have received a stem cell transplant within the last 2 years or are taking medicines to suppress their immune system should also get the booster dose or the third dose of COVID-19 vaccine. And again, people who are moderately or severely, have primary immunodeficiency, syndromes such as the DiGeorge syndrome, the Wiskott-Aldrich syndrome, should receive the third dose of COVID-19 or the booster dose. Advanced or untreated HIV patients should get the third dose as well at this point. And also somebody who's on active treatment with high dose corticosteroids or other drugs that may suppress your immune system should get the third dose of COVID-19. Again, we know we've discussed and we've talked about the guidelines for the different types of vaccines that are available to patients to get, which is in the United Kingdom, they have the Oxford AstraZeneca vaccine, which is a 2-dose vaccine And then we have in the United States, the Moderna, which is a RNA part of virus genetic code vaccine. Another one that is a 2-dose vaccine. And then you have in America and Germany, which is Pfizer BioNTech. It's an RNA type vaccination that also has a 2-dose. I received the Pfizer. So that was 3 weeks apart, right? And sometimes you can get it a little bit beyond that. And then you have different types of vaccines. You have the Sinopharm, like in Sierra Leone, we given the Sinopharm or the AstraZeneca. And then also they have J&J, which was a single dose vaccine. At some point, it was held and then restarted again with precautions because of blood clots that people were reporting, right? And then you have the Sinovac, another vaccine, or the Jamalia, another one is another form of vaccine. So all these vaccines are available to people to take, and wherever country you live in, whether in the United States, Asia, Africa, anywhere, whatever vaccine is available to you, the recommendation really is for you to get the vaccine and be protected. What is the WHO, World Health Organization's guidelines or statement about the booster dose? According to the WHO, the decision for a booster dose is a complex and requires beyond clinical and epidemiological data. An assessment in this context, should be prioritization and also to prevent a severe disease, right? So those people or those individuals that we just mentioned, those patients have either a moderate to severe immunocompromised conditions. Thereby, assessing the need for a booster dose is important according to the WHO. So think of it, the Delta variant, which is making everybody now scared. We thought we had control over COVID-19, right? People got vaccine, we started vaccinating individuals, and now we got the Delta variant, right? And then the Delta variant is more contagious, as I mentioned previously, than the previous strains, of COVID-19 that we had. So it may cause more than 2 times as many infections than the previously ones that we've had vaccine for. So with that, like for the original COVID-19 strains, 1 person will infect 2 individuals. And then for the Delta variant, 1 person can infect up to 5 individuals. So think about that, you multiply that. Every 1 person, infecting up to 5 people. So if you have 10 people in the room with this Delta variant, think of it. How many people will be infected with COVID-19? So that's why vaccines protect you from hospitalization, severe infection, and death, according to the CDC vaccine guideline. That means the Center for Disease Control and Prevention in the United States is recommending vaccination for individuals. As long as you don't have no contraindication, you should get the vaccine, and you should follow the guidelines to protect yourself and protect your community, as well as people around you and also your loved ones, right? And then infections and the spread. Like we said, the Delta variant is more contagious. It's highly contagious, and also the suggestion is that it may cause severe illness than the previous strain in unvaccinated individuals. Unvaccinated people remain the greatest concern right now. If you're not being vaccinated, you are the greatest concern compared to somebody who is fully vaccinated, can still, right? They can still be transmitting the virus, but you have to understand that The Delta variant breakthrough infection can spread the virus to others. However, vaccinated people appear to be infectious for a shorter period. As I always talk about vaccine, that if you have received the vaccine compared to somebody who has not received the vaccine, your time, with this illness or the virus, it's shorter. You have less symptoms compared to somebody who has not received the vaccine. So that's the benefit. You do something, you gain something. You don't do anything, you don't gain nothing, right? Even if it's 50%, you will get that just by getting the vaccine, right? So what can we do to protect ourselves? Definitely, vaccine is now available worldwide, and then it includes, protection or effectiveness against this Delta variant. And then with that, you want to wear a mask, given the fact that the Delta variant is highly contagious. Wearing extra layer of protection or putting strategies that can really protect and combat this virus or this form or strain of COVID-19 will help reduce the transmission of this particular variant, which is the Delta. And a reminder again, quick one, fever, chills, quick one for COVID-19 symptoms, right? We all know it, but let's just remind ourselves again, if you experience fever or chills, cough, shortness of breath, or difficulty breathing, fatigue, muscle ache or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, as well as nausea or vomiting and diarrhea, definitely get tested so that you know whether you have the virus or you don't have the virus, and if you do, so they can protect you. And before that, you definitely want to be vaccinated. Think about it. Think about the benefit, knowing that the benefit outweighs the risk of the vaccine, right? Prevention is key. Things to know about COVID-19. If you receive your COVID-19 vaccine, it takes about 2 weeks after vaccination to build immunity, for COVID-19. So definitely think about that. And that's why you should go to the cdc.gov, or WHO or other health departments in your states, your country, just to learn more about the different symptoms. What else can you do? Universal precaution, hand washing, cough hygiene, covering your cough or sneezes with the inner part of your elbow so that you don't spread the virus. And if you use tissue, make sure you dispose of them appropriately. Wash your hands with soap and water, and where there is no soap and water, you want to use alcohol-based hand sanitizer, and also disinfecting areas that you use more frequently. You can protect yourself, your loved one, and other people that come in contact with that space. Doorknobs, your phone, your different devices, computers. These are things that you definitely want to be disinfecting on a regular basis. And also stay away from people or crowd. If you know that you are sick, stay away from people and immediately seek medical attention. And also avoid self-treatment when you are ill or sick, especially now, because sometimes people think, oh, it's probably just a cold, I could just do home remedies and then I should be fine. Yeah, but sometimes you know exactly what is a cold and what is not. And right now, we're not in that timeline for us not to take the necessary precaution. So for that reason, I definitely urge you, if you fall between all these different people that we just highlight, the immunocompromised individuals, definitely you are being told, and I'm sure your healthcare provider, your oncologist, your specialties are going to talk to you about getting the third or the booster dose of the COVID-19. Until then, I want to say many thanks for listening, and I hope you take these very seriously and you learn about something today. You want to share it. So I want to take this to the Creole from the English language. Misalon fambu them, I just don't talk about COVID-19 vaccine. The symptoms then we know na fever, chills, headache, body they hurt, you dey sneeze, you dey cough, you dey feel like say stuffy, sometimes and they, you dey taste na you mouth na new one or the smell new, you don't even smell nothing, or you need to taste anything. But the main thing here, than then are the symptoms. I'm sure we all don't know, say if you get any of them symptoms there, so you want for seek medical help. And also the type of COVID-19 strain we don't come out when I call the Delta variant. In more serious, in more contagious, it affect people them so rapidly, right? Somebody will get the Delta variant compared to the one we been just get the regular strain we been get from December 2019. So one person they infect 2 people them. So with the Delta, it infect 5 people them. Think about it. If you get people in the room, how much people then people then they go to infect, right? So now make with this particular variant here, then we recommend say people that will get immunocompromised condition, somebody will get cancer, will they get treatment, somebody will don't get transplant for either the liver, the kidney, any type of organ, they don't transplant and then they take medication, or then they take steroids like high dose of steroids, then people then they recommend, or then get AIDS or HIV, where they not treat, then they recommend and say let them take the 3rd dose or the booster dose of COVID-19. If they do that, it will protect them, because then people then their immune system is very compromised. So we all know say the Pfizer vaccine day, the Moderna day, we know say the AstraZeneca winner from the UK, as well as Sinopharm, we self na salon so down they don't give we from China, and also the one we then give from the UK, right? So all them different things there. So what to make we need them? We want to make sure say we protect ourselves from the Delta variant, because the particular one here, it is spread very rapidly and very easily. And if what again you go do, you don't take the vaccine for continue for protect yourself, for make sure say you wash your hand, you wear mask, you clean places then where say you constantly touch on a daily basis, your phone, your tablet, your laptop, anything, the domots them, the way they turn the knob, and also way they use public transportation, way done. You wash your hand. If you cough, make sure you cover your cough. Make sure you use tissue. If you use the tissue for cough or sneezing, make sure you dispose of them well, and you wash your hand with soap and water. If you don't get soap and water, what do you need for do? Now for use alcohol-based hand sanitizer. And then again, after a certain number of time, definitely you want for make sure say you wash your hand. So definitely this is not the recommendation where I will give you for say this variant is very dangerous. We already don't see the cases them they stop. The World Health Organization not tell we say COVID-19 done, because COVID-19 when you get the vaccine, you need at least 2 weeks for no say you don't get protection from it. So with that, you get for make sure so you take all the different necessary precautions and for let you go protect yourself. With that, I want for left and also, and I want for tell you say what you don't learn, no left and share them. Make loud a person know what you and them for do for protect themselves. Okay, until then, don't forget for subscribe, don't forget for like, don't forget for share and comment, and make a know what you want for make a talk about the next time we come to we health. Until then, me na Dr. Isatu Kakay-Diallo, family nurse practitioner. And again, our viewers and listeners, I want to say many thanks for listening to me today, and do not leave it here. Please remember to subscribe, share, comment, like the program, and hit the notification bell for more videos, and let me know what you would like for me to discuss the next time. Until we meet again, this is Dr. Isatu Kakay-Diallo, family nurse practitioner. Thank you.